The Clog Zapper. Clog Zapper is an enzyme-based declogging system for enteral feeding tubes. It is made up of foodstuffs found in everyday food. The ingredients are maltodextrin, potassium sorbate, ascorbic acid, citric acid, disodium phosphate dihydrate, sodium lauryl sulfate, disodium salt EDTA, and the enzymes cellulase, alpha amylase, and papain. Clog Zapper can be used on any type of feeding tube, such as an NG, NJ, PEG, G-tube, J-tube, button, surgical J-tube, or Foley catheter, and any brand feeding tube. Clog Zapper is for enteral use only and single patient use. It is non-sterile and not to be used for IV administration. Prior to using Clog Zapper, make sure any visible tubing is free of kinks. Use the syringes found in the Clog Zapper kit. The applicator is used to administer the Clog Zapper inside the tube. It is a necessary piece of equipment and plays a crucial role in breaking down the clog. Depending on the location of the clog in the feeding tube, the applicator might not reach it. This is okay because Clog Zapper will find and clear the obstruction. Use Clog Zapper upon first acknowledgement of a clogged tube to maximize its success. Use gauze pads to clean up any spills caused by the applicator or syringes. Always check to see if the patient is on a water-restricted intake program. The amount of fluid used should always be recorded in the patient's intake-output volumes. Clog Zapper is formulated to break up formula clogs, but may not work on some clogs resulting from certain medication. Remember to use liquid medication if possible, and crush pills thoroughly. The use of enteric-coated pills is not recommended with feeding tubes. Clog Zapper in the powder form is good for a year and is marked with an expiration date on the package. To use Clog Zapper, open the package. Make sure you have all the components of the kit: the directions, gauze pads, an applicator, a flushing syringe, and a syringe with Clog Zapper in the powder form. Now take the applicator and insert it into the feeding tube Y port. Be careful not to use excessive force when inserting. Place the applicator completely into the tube until it rests against the hub of the applicator. If it is impossible to place the applicator into the tube, it may be pressing against the clog. If this is the case, take the applicator out and cut it to an appropriate length. Turn off the enteral feeding pump and close the roller clamp on the feeding set. If you are doing a gravity feeding, just close the roller clamp. Next, take a small amount of tap water and put it in a cup. Fill the syringe with the Clog Zapper powder to the 10 cc mark with water. This will take approximately 7 cc's of water. You will have a total of 10 cc's of liquid in the syringe. After you draw up the water, shake the syringe vigorously for 3 to 5 minutes, making sure all clumps are dissolved. Once the Clog Zapper is mixed, it is good for 24 hours. When not in use, keep the mixed Clog Zapper refrigerated. Place the gauze pads at the Y port, where the applicator is. The gauze pads will be used to soak up formula displaced when Clog Zapper is injected inside the feeding tube. The Clog Zapper formulation can cause irritation if it gets in contact with the eyes. Protective eyewear is strongly suggested. Insert the mixed syringe full of Clog Zapper in the applicator, making sure it is seated properly. Once the syringe with Clog Zapper is in the applicator, administer 2 to 6 cc's Clog Zapper, depending on the tube size, through the applicator while holding it and the syringe. Make sure when you administer Clog Zapper, you use firm but gentle pressure. Because the applicator is such a small tube, The force it takes to push in the zapper is great. You will know you have added enough Clog Zapper when you see it coming out of the tube instead of formula. Once you have added an appropriate amount of Clog Zapper to the tube, remove the applicator and cap off the feeding tube. Keep the feeding tube in an upright position as much as possible so gravity can help the enzymes work. A replacement G-tube is approximately 9 inches long. So, if using it, cut the applicator just above the black dot located at the 9-inch mark. Wait 30 to 60 minutes for the enzymes to break down the clog. The closer to 60 minutes you can wait, the better the enzymes will work. Draw up water using the flushing syringe provided in the kit and flush the feeding tube in order to clear it. If the tube cannot be cleared, repeat the steps until it is cleared or you run out of Clog Zapper solution. After the tube is cleared, dispose of the materials per hospital protocol. Resume feeding of the patient. If you have any comments or questions, please contact your CorePak sales representative.